Hello everybody. Today I would like to educate you on what you do after you complete a total nail removal or a matrixectomy. For this patient today, I just conducted a matrixectomy, which is removal of the toenail, as well as burning the two corners of the nail bed and the nail matrix to ensure that the nail does not grow back in order to treat the ingrown toenail. Now I would like to introduce you to a de novo product that I have been using now for over a year in my office after ingrown toenail procedure. It's a hydrocharged wound gel, not like any other wound gel that you have had before. It's plant-based, very natural, okay? This product, you can actually even put it in your mouth and it's not harmful because it's all plant-based and it's 100% natural. And what I've been using it for my post-nail avulsions and my post-matrixectomy, because this product is so good. It is antifungal, antiviral, antibacterial, so it's going to help, it's going to kill bacteria on contact. And when you think about the nail and how dirty underneath the nail is, with all the fungus, with all the bacteria that's been harboring for a very long time, you really want a product that's other than just a simple bacitracin and mupirocin or triple antibiotic that you and I have been used to using for years. Ingrown toenail procedure obviously is very common for podiatrists to do. But what's common is that we usually would just prescribe Silverdene or like I said, an antibacterial, and not really pay attention to the fact that we need something that's antifungal. And it's also good for burns. This supercharged hydrogel, this is the Lavior Wound Gel that I've been using now for over a year, has really reduced my infection rate. And what I recommend is that after you remove the nail bed, take time to really debride and activate the nail bed, removing as much of the devitalized tissue, infected tissue, to ensure that your treatment is going to be very, very effective. And once you're done with that, you're able to apply this, you see, very green, very plant-based hydrogel right on top of the nail bed, and then you're able to just dress it up. And then you give the product to the patient for them to do the same at home after their soaking instructions. Okay, so remember, you know, just don't do the normal or regular thing, which is to tell the patient, you know, go home with some mupirocin or antibiotic, put it on it, and that's it. Really try to reduce the patient's chance of fungus coming back on the nail, killing any viral warts that we might have underneath the nail, which you know that there's a lot of warts from old chronic nail infection, and also giving something that is antimicrobial, okay, anti-scarring, antiviral, that's gonna really help the wound heal. And it's a supercharged hydrogel, so it's gonna accelerate wound healing, especially when you have patients that are diabetic. So I would highly recommend that you get the product, have it in your office. The product is actually available at Walmart. You can just pick it up. Patient can pick it up, or they can just purchase it at your office and they can get a bigger bottle, which is what I recommend. So how do you feel? Feel pretty good?
Good.
Excellent. So now I'm just gonna go ahead and dress it up. I'm just gonna put the hydrogel on it. Okay, just put it all over it. And the patient can see me doing it so they can repeat the same procedure at home. So I really like to spend time really debriding that nail bed, which I think most podiatrists sometimes fail to do. If you want to have a really good outcome and reduce the chance of the nail coming back dystrophic and infected with fungus, which is our main concern, you really want to make sure you debride the nail bed pretty good, and then offer the patient a product Like I said, that is antifungal, antiviral, anti-scarring, and antimicrobial, which means that it will kill whatever bacteria on contact that is on the nail bed, and really increase your success. My patients love it. The diabetic patients are always having delayed healing, so with this product, their nail bed wound heals much faster, and they feel very comfortable with it, and it's not so expensive. It's quite affordable, and the patients love it. Okay, that's all. Okay, thank you.